So I'm going to go ahead and introduce to you our guest speakers today, serving the Lāhui through food and nutrition. And let's see here. We'll start with Marie Kainoa Fialkowski Revilla. She is a Native Hawaiian faculty member in the Department of Human Nutrition, Food, and Animal Sciences at the University of Hawaii at Manoa. She has been working to gather more comprehensive diet and health-related information on Native Hawaiians in an effort to be able to develop and evaluate culturally appropriate health promotion activities. She also has been working to support the delivery of dietetics education that reflects the Pai'aina as well as facilitates the success of Native Hawaiians in the degree. Also, we have, if I can get, oops, sorry. Monica is a wife, mom, daughter, sister, and outrigger canoe paddler and a resident of Kaneohe, Oahu. She works as a registered dietitian and certified specialist in, oh, sorry, let me stop, share. You can see the bio. Okay, Monica is a wife, mom, daughter, sister, and outrigger canoe paddler and resident of Kaneohe, Oahu. She works as a registered dietitian and certified specialist in sports dietetics, having completed a Bachelor of Science degree in food and nutrition from San Diego State University, master's degree in dietetic internship at California State University, Northridge, and went on to earn a PhD in nutritional sciences at the University of Hawaii at Manoa, as a trainer of the Children's Healthy Living Program. Dr. Esquivel has worked in a number of community health and nutrition roles, which all aim to improve the health and well-being of individuals and communities through food. So I'd like to welcome both of you. Mahalo for joining us. So let's start with the first question. So how did you guys get interested into nutrition or dietetics? And we'll start with Monica.
Sure. Hi, thank you also for having us. It's an honor. This is my favorite thing to talk about because it's food, right? So, when I remember kind of starting my journey, I thought, oh, I wanted to help people improve their lives. And I thought I'd be an athletic trainer. I'd always been in sports and things. And I spent a little bit of time with some athletic trainers. And I thought, oh, this is not fun. Like, I don't want to stand on the sideline all night, all weekend. And then I actually, our team met with a dietitian and I thought, this is a cool job. Like, I get to talk with people about food all day, and food is something that really connects everyone. And you have such good memories of food. And I thought, well, if I can help people improve their health through something so common, it just seemed like a natural fit. So that's where I kind of came to this pathway. Yeah.
Nice. How about you, Kainoa?
Aloha mai kako. Hello, everyone. Mahalo again, Lisa and the whole crew for having Monica and I here. We're definitely honored. It all started with my mom. She's like the best cook ever. So, just that love for food, and like how Monica was saying, it's central in like all that we do. And there's so much memory and just spirit there. And I wanted to be in a field that would allow me to serve the Lāhui, and we all have to eat. So it's a great field to be in because there's always going to be a need.
That's awesome. Mahalo. So I heard that there are slides.
Yes.
Okay.
I can go ahead and get those started. And then Kainoa, just tell me when you'd like me to advance.
So again, mahalo Lisa for our introduction. Really honored to be here on behalf of our program, our department, our college, and the university, and stoked that we have people who are interested in the field. And so before Monica and I begin, we just want to mahalo Papahanao Moku, our grandmother, for having this beautiful pae'aina that we're able to enjoy, acknowledging that the university that we work for, you know, is on our ancestral territory, the Kingdom of Hawaii. And then just, you know, reminding all of us of our kuleana to take care of this aina so that we can continue to nurture it and grow it for our future generations. So just want to make that quick acknowledgement. And then, you know, kind of to start us off, you know, we mentioned about how pivotal food is in our everyday lives. And I think it's also important to acknowledge our kupuna. Like our kupuna knew how important food was. And so there's a little no iao. It just speaks perfectly. Iolo no ke kino I ka maona o ka upu. The body enjoys health when the stomach is well filled. And that is all about what we hope to accomplish in the field of dietetics and food and nutrition. And so Monica is gonna take over.
So we just had a few learning objectives that we wanted to share. The first being to increase the awareness of the registered dietitian, nutritionist, or RDN profession. Explore career opportunities for RDNs to serve the Lāhui. Learn about the RDN training pathway that we offer here, and identify and share some of the initiatives of our program that are aiming to fulfill the UH commitment to being a Native Hawaiian place of learning. And so I always start with this, wait, what's a registered dietitian, nutritionist, or a registered dietitian? And so this is a really funny little comic. He said, sure, call me a nutritionist. Said no dietitian ever. None of us have ever said that. And why? So registered dietitians are the experts in the nutrition field. Within our state, these are licensed nutrition providers, and some other states also carry licensure. Registered dietitian nutritionists, or RDNs, adhere to a very specific code of ethics. We have standards of practice. And when you see an RDN, or you're working with one, or when you carry that credential, you can be confident that that person has completed a very rigorous and accredited training program. On the contrary, nutritionists, there's varying degrees of program quality and not a national set of standards of practice. And so, you know, I don't like to say that all nutrition training, you know, nutritionist training is poor quality, but the issue usually is the consistency. And so almost anyone can go through and call themselves a nutritionist. So that training pathway that I talked about, that's very specific to a registered dietitian nutritionist, has 4 steps, 3 to 4 steps. And so the first step begins with completing an accredited didactic program in dietetics. And second step is now completing a graduate degree, which is a new requirement for our profession starting in 2024. So in that step 2, you have a graduate degree as well as an accredited supervised practice, or a dietetic internship. And so that's a 1,000-hour experience where students are interns and they're working under dietitians in various places in the field. The third step towards becoming a registered dietitian is completing the registration exam. So there's one national exam that all dietitians take. And then step 4, in our state, you'll apply for licensure. And so where do RDNs work? So one of the things that I've found that's very exciting about the profession for me personally was the opportunity to work in so many different fields. And so you'll see some images here. You can do counseling with individuals. Now with COVID, there's this whole boom of telehealth and telecounseling and providing services from distance and remotely. There's a lot of fun community outreach and food demonstrations and nutrition education that we share with the public. This Dietitians on Demand, it represents the idea that just like nurses and other health professions, dietitians have opportunity to work in traveling roles. So if you're a person interested in traveling and working in different places across the Pacific, even, I know in Guam, oftentimes they have traveling RDNs. That's an opportunity. We can do research, as well as even working in food service roles within clinical hospital settings. So those are places we work. And so what are the things that we actually do? I saw it was recently Registered Dietitian Day, and it was like what people think we do. And it's like, a cooking kind of demonstration. And it's like what we actually do. And there's all of these things that we can actually do. And so I think, what we recognize is that, so we can work dietitians on like all the different ways that eating behaviors are influenced. And I think more traditionally, everyone, and this is me included, when I was coming through this career, I thought, I'm going to work with people. I'm going to work with them one-on-one. And it was a very simple idea that, maybe I need to help people achieve a healthy weight. And I'm going to work with them on the energy they consume, the foods they consume, and their physical activity. But, as you grow and mature and understand and learn about the profession, and you can work in all different levels, because we know that individuals, they operate within family structures and social structures. And so dietitians have opportunities to work in those settings. Dietitians work in schools, and they can work in churches and other organizations to influence a person's eating behavior. We can move upstream to work on more community level projects and even policy. And I'll share a few examples. So putting this into practice, so thinking about, what we do as a dietitian. So it's so much more than this like very simple kind of equation here. But what I like to think about is my role at this intersection of health and food and culture. And so a dietitian can operate right here where those ideas and those things intersect, to create and develop and implement interventions or programs that help people to achieve wellness. But part of the things that we in our profession can do is help to figure out, how do we define that wellness? And as we're developing these programs and interventions and thinking about these, issues, we can think about who's responsible, so is it the schools, healthcare providers, kupuna, government? We can think about, as we develop these programs and work with individuals and communities, about the cultural considerations that are being made to help achieve wellness. We also think about here on the bottom, who our audience is. So who are we targeting? When are we intervening? Are we intervening before a person has developed a disease or after? And then really, what's the approach we're taking? So kind of is a little bit of like a glimpse of, I think, at least how I perceive what we do. And so one of my favorite stories about I call it like an RD superstar school nutrition success story. So locally, we have a registered dietitian who works at the Department of Education. And so part of her kuleana is to oversee that the school menu meets the federal nutrition standards. So the government has policy about how much nutrients are provided in these school lunches, and sodium restriction is one example. And so recently, with some policy changes, it came about that the Portuguese sausage that the DOE was purchasing did not meet the sodium guidelines from the federal government. And so when the RDN, reached out to the manufacturer who they buy this sausage from, said, I'm sorry, we're not going to be able to buy your product anymore. It no longer fits within our guidelines. And so as a result of that, the manufacturer actually changed the recipe that they used to create their product, because they didn't want to lose the business of DOE, because it's such a large customer. And so what's really cool about this story is that not only do the children get to enjoy something that's familiar, the lower sodium content, but that lower sodium Portuguese sausage doesn't just go to schools. That same formulation is purchased by our Costco's, our Sam's Clubs, our restaurants, our McDonald's, whoever, so other places are also getting this kind of lower sodium product that is just the work of one dietitian, that I just think it's really cool. It's just not like what people think, sitting in a hospital helping people who are not feeling well, right? Another really cool example of the work of registered dietitians is in changing the food environment. So this is thinking about that community level work that we can do as a dietitian. And so this was one of the campaigns of the Hawaii State Department of Health. It was the Choose Healthy Now campaign. And so through this campaign, the dietitian was networking with convenience stores and other local shops to figure out how they could do some shelf labeling to help identify some healthier options for consumers. And so just going in, and I know that at this time I was actually living in Makaha and stopping in our 7-Elevens, and you get to see these things, and it brings your attention to like, okay, I could get this, I could get a banana, it's sitting here and it has this beautiful label that's saying eat me, or I have just helping to bring to light that those healthy options are around. We try to, you'd see in the stores, most things are green. We really kind of avoid having the yellow and red, but at least pointing out the positive availability.
We do have a question. Are you allowed to share the brand of the Portuguese sausage?
I don't actually know it because I wasn't that dietitian. So I could ask the dietitian I know. I can find out. But I'm pretty sure at the time it was the one that DOE was buying, but I will look into that and I can share. Good question though. And so what we also know about dietitians in Hawaii is that across the country, Hawaii actually has one of the second highest concentration of RDN jobs. So we have a lot of opportunities for individuals who want to be dietitians here in the state. What we also know is that, so here you can see a map, and so it's kind of where the concentration of the RDs are. And so the majority, as you probably could guess, of the dietitians in our state are located here, in Honolulu. So there are disparities across our islands of the availability of these services. And so that's something we hope to help address with our program and this work. We also know that overwhelmingly dietitians across the US are white females. And so, that's part of our program's also desires to help to ensure that the dietitians, at least, working in our state and with our communities, really mirror the populations that are being served. And so why do students pick us? So students, just how Kainoa and I shared, they pick our major because they have a passion for food. Some are interested in health and science. There's also broad applicability to other health professions. So we've had a number of students go on to become registered dietitians and then go on to JABSM into careers in medicine. We've had students go into physician's assistants, PA work, dental hygiene, even a lot of different professions. And they're appreciating having that kind of baseline foundational knowledge of science and nutrition. And then, of course, the majority of our students are interested in working as dietitians. I just included a little bit about our coursework here. So we, our coursework includes a lot of basic sciences at the undergraduate level, courses in food service and food systems management. So not only just food preparation, experimental foods, food management, learning how to kind of manage large food service operations. And then as far as nutrition goes, so there's everything from basic and lifespan nutrition, learning about nutrition assessment, community nutrition, clinical nutrition, and sports nutrition. So the coursework really lays the foundation for students to kind of leap off into many different directions. And so I love these pictures because it's our students in action. So our degree requires a 100-hour field experience. And then the pictures you see here are many of them are of our dietetic interns in the Individualized Supervised Practice Program, or ISPE. And so these are students that are completing that 1,000-hour internship requirement, doing out in the community, doing kind of nutrition education. A couple of images here of our food recovery network on campus. So we take food from like campus dining that was going to be thrown away, and it's brought down to IHS. Working in the Lāhui. I'm not sure which Lāhui that one is at, but so that was probably for a field experience student. And then also sharing about foods and food preparations and food history. And this was an event we had with some students who visited from Japan, of course, before the pandemic. And then we're going to transition. We wanted to share this video. I'm going to see if it'll play right here. And it's just a little snippet from one of our students. Maybe I have to. Oh.
The dietetics program has helped me to understand that what I learn in the classroom can be applied to myself. And
We'll have to, you'll have to stop share and then reshare and then click the bottom of it where it says share sound.
Okay, I'll do that. Thank you.
Yeah.
I feel like it's like playing in two places now.
Well, someone said they could hear it.
Okay.
So there's a little check box at the bottom that says share sound when you hit the share screen.
Okay. Let me see. Oh, I thought it was so smooth to have it in my presentation, you know. Okay. We got it.
Hawaii, the dietetics program has helped me to understand that what I learn in the classroom can be applied to myself and also to those in my community.
Our students take a number of foundational science courses. Once our students are done with all of that biochemistry and organic chemistry, they can start to take more of our nutrition-focused courses like food preparation, food chemistry, lifespan nutrition, community nutrition, and finishing it off with medical nutrition therapy, where they learn the specific diets for a number of chronic diseases. We really wanted just to showcase Kayla there because we're so proud of her. So I didn't mean to continue on where you had to hear even more from me.
It's perfect.
Maybe Monica, I'll put the link in the chat in case
Okay.
people want to go and watch the whole video. I'll go do that right now.
Thanks. All right. All right, and so the next few slides, we're going to transition to share about some of our program, our department's initiatives, and how we think we're trying to fulfill the commitment to being a Native Hawaiian place of learning. So Our training program is the only non-distance accredited training program for dietetics in the US Pacific. So we do fill that need. We have both the undergraduate program and the Esquivel program that fulfill 2 of those training requirements for becoming a registered dietitian. We really view this as the opportunity to train and prepare graduates for working with our communities here. And so there are a number of programs that are distance programs where we know folks that are living here might enroll in, I think, Kansas or others. And so their curriculum comes from those institutions and they're able to complete their work here. And so we like to try to fulfill the need to prepare students really with our curriculum.
So just to add to that, you know, we've really tried to demonstrate our commitment to building capacity for the Lāhui with funding from Kamehameha schools. You know, we've taken a careful look at our curriculum, aligning that with culture, you know, looking for ways to address costs and accessibility. You know, we also acknowledge from the work that we did that having supportive faculty and mentors, especially from diverse backgrounds, is important. And then just, you know, increasing visibility. So with this work, we've been trying to do that. So in regards to curriculum, Monica will show on the next slide. You know, we've really tried hard with our courses, developing courses and modifying courses that reflect our curriculum, that really, you know, have that be the focus. The majority of our students inherently come from the Pai'aina. And if we want to, you know, include more Native Hawaiians in the field, we recognize that's a, you know, pivotal, you know, point for our department. And so one of the other ways in which we've been trying to do that, in addition to the curriculum, is also through developing resources. Oh, sorry, with the curriculum. Yeah, no, you're right, Monica. Next slide. We've, you know, worked hard to get designations on our courses, making sure they have the Hawaiian, Asian, and Pacific focus. Particularly Hawaiian and Pacific Islander focus. So our introductory nutrition, all introductory nutrition courses that are offered on the Manoa campus has this designation. And, you know, this is great. This is a first ever. We just received the approval starting fall 2022. And so it's exciting and a way in which to possibly expand across the UH system as introductory nutrition is taught pretty much at every community college in the university system and some of the other 4-year institutions within the University of Hawaii system. And then we also have some upper level courses with that designation. And so with that too, again, you know, one of the other important points that we found in the work that we were doing is that cost is, you know, really important. And I don't think that is specific to our program, that's just college in general. And so we've been really trying to, you know, take that responsibility, that kuleana, seriously in developing open educational resources, textbooks, specifically for our students, for our region. So we've developed an OER textbook, Human Nutrition, pictured here on my left. And then we're right now working on a lifespan nutrition textbook that we hope to be launching within the next year or so. And the really great thing is that they're free. It's completely free. So we're eliminating, you know, one of the many costs that students have. And then the other great thing is it's easy to be recycled and adapted and remixed by instructors. So it's another great advantage. Some of the other things that we wanted to mention was, let's see, next slide, Monica.
I do have a question.
Yes, sorry.
Are you ma'a to Uncle Herbert Hoy and his Aipono teachings?
Yes, yes. I've had the honor of actually going to visit Uncle up in Molokai and talking story with him. So yeah, I actually think in our introductory nutrition class, I may have incorporated some of his interviews that he's done previously on Aipono. So yeah, we definitely want to honor his knowledge. And some of our other members of the community who are super knowledgeable in Aipono, like Auntie Ka'iu and things like that. So we try to integrate that into our curriculum as well. That's a great question, mahalo. One of the other really, really great things, I think Monica should probably mention it, you know, we recognize that outreach is super important, like us being given this opportunity to share on this webinar. So Monica, first ever next week. Monica, you want to share?
Yeah, so we got seed money, literally seed money from our diversity office here on campus to do a little outreach. And so we're offering a spring immersive experience for high school students where they get a little bit, literally a taste of a few of our like fun courses that they might take. So they're gonna get to do a little food prep and create a healthy kind of lunch, and then learn about some basics of nutrition. And then we have another experimental foods kind of portion where they'll learn a little bit about sensory evaluation, and they're going to build some ramen noodle bar kind of thing, and then do some nutrition assessment. So learning about, you know, how to take blood pressure and what these different measures mean. But what's been really neat about it is that, you know, the undergraduate students, I gave them the courses and they're really developing the material. So the idea is that high school students will see, you know, what our students are doing, and they'll kind of get that mentoring sort of experience with the high school students and then the college students. So yeah, so I'm pretty excited about it.
So we're hoping, I mean, I know we're going to learn a lot and it's going to be great. And we'd really like this to be something that we sustain and do over the long term. So we're kind of putting things in the work. So hopefully this trial run next week during the spring intersession is something that we'll be able to hold every fall and spring intersession. So more to come on this. Yay, thanks, Monica. I think the next one was just, and then so Monica had mentioned with those awesome photos of all the things that our students do in the program, which I think is another valuable aspect of the program of, you know, our students, yes, we spend time in the classroom training them on these various concepts that are important to the field. But the really great thing is that the students actually get to go out. We have a 100-hour field experience requirement that they do in their senior year. It allows them to apply the knowledge that they learned in the classroom in a professional setting. However, it also helps to support community partners, makes valuable networking opportunities for our students. And, you know, we really try to have students be the drivers selecting their placements versus, you know, you got to work here, here, here. So it's really nice. Some examples, we've had students work at Malama Kauai, creating recipes, Hawaii 5210, developing My Plate. So there's been really, you know, some great ways in which students have applied the knowledge they've learned, helped community partners, and then, you know, developed relationships that they could possibly take, you know, will carry forth once they get through the end of their training, and they may be able to work in those spaces once they're, or, you know, they've finished all of the 4 steps to becoming a registered dietitian. I think Monica, and then the one really important thing that we found through the work that we were doing, you know, as we were kind of going through this process of seeing how we can, you know, better be committed to be a Native Hawaiian place of learning, a Native Hawaiian program. We already had, and, you know, Monica does a really great job. She has an advisory council that advises the dietetics program. But we really wanted to make sure that reflected our community, our Native Hawaiian community partners, and other knowledgeable practitioners. So we've included them into our community advisory board, or our council for the dietetics program, just to ensure that we're kind of doing what we can to be a Native Hawaiian place of learning. So I think that's one of the other great outcomes of the work that we're doing to demonstrate our commitment. So I think that might be it, right, Monica, I think? Yay.
So I wanted to share a few like resources for people about some of the work that's happening. And then I think, yeah, if there's any questions. contact. And I'll be sharing the slides. I'll send those out as a resource.
Mahalo for that. We are open for questions. I know someone had a comment that said, oh no, no more Frank's foods.
Right.
Well, you know, we teach in our program that no food is a bad food. So there's nothing wrong with a red hot dog or whatever it is every once in a while. So there's no such thing as a bad, you know, there is no bad food. So, you know, that's something that we don't teach in our program. So just wanting to make sure we clear the air on that.
Yes.
I do have a question. So, you know, before the webinar started, Monica and I were talking about, you know, how it's such a delight to be talking because, you know, to be honest, which is not fair, you know, people don't automatically think of when they want to go into healthcare, I want to be a dietitian, I want to go into nutrition. It's like always the typical, like the normalized, I want to be a doctor, I want to be a nurse, you know. So what are, you know, what are the challenges, or how would you, you know, tell someone, you know what, come into nutrition, we really need you, and this is how great it is? Like, what are the challenges?
I think, I mean, just when I've thought this through a lot, you know, in my position where I am, and I've thought it, just thinking of a hospital itself, you have a hospital with all these floors, and each floor has how many nurses or how many physicians or pharmacists. And so based on sheer volume, like one dietitian might serve 3 or 4 floors, right? So we carry a bigger caseload. I think that's one thing. So just the numbers of us are smaller than some of the traditional health professions. And I think a lot of, you know, I think food is sometimes taken for granted, like how it ends up in front of you, right? And so people they take for granted, oh, this food just ended up in front of me. You see that maybe in the cafeteria in school, you see the people serving you the food and you appreciate them, but you don't see the dietitian making decisions somewhere else. And so I think the visibility has been an issue. Healthcare reimbursement is an issue. So this coverage of our services, I think those have been some of the challenges I see.
You know, and I think with the healthcare reimbursement thing, you know, the other thing, you know, they had legislation that went through that all the other professions, they would get tax breaks, but not registered dietitians. So I just think that our visibility so that's why we're trying, you know, trying to do what we can to increase visibility and let students know that this is, you know, another great way in which to serve our community, to serve our people. And there's lots and lots of different ways in which you can do that.
So how many, do you know, like approximately how many Native Hawaiian students are in the dietetics program? 5 out of how many?
I think we have right now between the junior, so we admit people at junior level. So we have probably about between 40 and 50. So it's like, it's usually wavering about 9% or 10%. And this is as a result of a USDA grant that we received to really support those 5 students.
Wow. So, and then most of those students are local, right? Or from neighbor island?
Most of them are from Oahu. Yeah. Every once in a while, we might get a transfer student from the mainland, but most of them are from Oahu.
Yeah. And then how is it? So you said there's like a high demand for dietitians and nutritionists, right? So I don't know how, like where, like what locations? Because people, I don't think, like even I don't know, like where does a dietitian end up working, right? Yeah. Like other than a hospital.
The long-term care facilities all require a dietitian, so to be there. Even some of the home care homes, they'll have one. It might not be a full-time position for each care home, but they have to have a dietitian assess their patients. So there's home care opportunities, dialysis centers. Unfortunately, is a growing number of positions for dietitians. the clinical settings, the hospitals, like I mentioned. There's, you know, most of our federally qualified health centers have a dietitian. And that's a lot of times because those health centers have different arrangements with their health insurance providers that allow the dietitian services to sometimes be covered and billed for under some other services or higher reimbursement rates. Where else? The Department of Ed is another one. On campus here, we have a dietitian.
Nice. So what were the challenges where did you guys get your dietetics degree? Was it there?
I did mine at San Diego.
Oh yeah, that's right, you did. So what were the challenges as going to school elsewhere to get your degree? Like, did they have the same challenges we have here?
So I grew up in Virginia, and so when I went to school in San Diego, you know, I think a lot of I think this is a thing that
A common thing.
lot of people, I don't think it's necessarily unique to here, but what I think is unique to here, you know, is a strong connection in how food connects people so much, you know, and so I think that is another thing that's unique that we can do a better job as kind of sharing, you know, would draw people.
Awesome.
You know, and I think one of the really great things under you know, Monica's leadership and our previous dietetics program director that you know, when Monica and I were going through our training, there wasn't really an opportunity to do a supervised practice here in Hawaii. And so that was another challenging thing for our students, you know, the reality that they would have to go to the mainland. But now that's no longer the case because Monica has a supervised practice that's integrated into our program. So you can achieve all of the components to becoming a dietitian right here in the Pai'aina, serving your community, which, I mean, when we were doing our training, that wasn't an option. So, you know, I think we're making steps to make it easier for students to do that, working within the communities that they want to work with. So
that's awesome.
So to like share about how important it is, Vernon, I think, so my first job as a dietitian here was out at Waianae Coast Comprehensive Health Center, and having grown up and being trained on the mainland when I came, you know, I had just no idea of all of the different practices around food, what local foods were. And so it was really like on me to go and find that knowledge and understand my patients. And so what we find is that, you know, so sometimes, like I mentioned, the traveling dietitians, they fill some of the needs here and they don't have those experiences. And so it's hard for them to really connect and talk about food without that knowledge, I think. And so I think that's kind of another, it is just emphasizing how important it is.
Nice. Mahalo. Any other questions out there from our audience?
I saw Kim's question about recruiting from hotel food and beverage employees.
Oh, okay.
And it is actually interesting because we've had a number of those. We've actually had a few people, especially during the pandemic, that are reaching out to me on how to transition from those careers into, you know, even food service in the hospital and in dietetics. And so it is a new kind of leverage point that I think people are finding. Yeah.
Great. Any other folks have any questions? We have like 16 minutes left. All right, well, if there are no questions, we will have the recording out and the slides sent out to everyone. The next webinar that we have scheduled, they're on the 2nd and 4th Fridays of every month. And the next one, actually, we are not going to have one because it will be Kuhio Day. So the next one will be in April, the 2nd Friday in April. And that topic will be about bereavement resources. We have Leilani Maxara, who will be joining us as a guest speaker, who is a death doula. So that'll be interesting. So if you're able to join us, don't forget to register. We'll have an announcement out soon. And then I'd also like to, again, mahalo Monica and Kainoa for joining us today, and also for my tech support, Kamuala Kalai and Kaimi Hano Hano and behind the scenes. And we'll have an announcement soon, and we'll all keep in touch. So ahui ho and malama pono, everyone.
Uhiho, mahalo.